Good morning. This is Bisia Demoiwa again. It's been a while, but I'm back, so there's no time as the present. I did want to talk a little bit today about breast cancer in Black women because, this is a time of global racial reckoning and awareness, particularly of disparities in healthcare and really in, all walks and spheres of life. So I am a breast medical oncologist. I practice in a large academic institution in the Midwest in the United States, and I treat all forms and all stages of breast cancer. And one of my passions, which has sort of developed more and more over the last few years, is really trying to understand and tackle racial disparities in women who have breast cancer. So I just wanted to talk a little bit about the statistics and what we as Black women can do for ourselves, advocate for ourselves. So as you may all be aware, breast cancer is one of the most common cancers diagnosed in women worldwide, and indeed in Black women as well. While we see that the incidence, so how many breast cancers overall develop, they develop much more commonly in white women. However, Black women who have a slightly lower incidence than white women are unfortunately more likely to die from breast cancer than really women in any other racial category. So, in other words, a Black woman is less likely to develop breast cancer, but once she develops breast cancer, she's much more likely to die from breast cancer than her white or other racial category counterpart. The other thing we see is that there are several forms of breast cancer. So not all breast cancers are the same. Every breast cancer is completely different, biologically different, and treated differently depending on the biologic characteristics and of course the stage. So the garden variety type of breast cancer is hormone fed, that's estrogen fed, basically feeding off estrogens in a woman's body. And that form of breast cancer is generally not that aggressive and is more likely to be cured if detected in early stages. There is another form of breast cancer which is quite deadly. It's called triple negative breast cancer. It is not fed off estrogens in a woman's body, and we don't really know the drivers of that aggressive form of breast cancer. Unfortunately, we see that that form of breast cancer, triple negative, is much more common in Black women, particularly Black young women. And so, again, unfortunately, if a woman, any woman, white or Black, is diagnosed with triple negative breast cancer, if diagnosed in early stages and is treated properly, it is more likely to come back and kill the woman than the garden variety estrogen-fed breast cancer. And also for those patients who have metastatic triple negative breast cancer or stage 4 triple negative breast cancer, meaning that the cancer has spread to another body part and is not curable, the average survival is now about 2 years. Has improved over the last couple of years, but ultimately will kill the woman at some point. So having said that, breast cancer in Black women is just more aggressive than in white women. And that, happens for a variety of reasons, some of which are still unclear. However, what we see is that a Black woman is more likely to present with a more advanced stage of breast cancer. So either cancer that has spread outside the breast and perhaps gone to the lymph nodes and the armpit, or has even spread to another body part. And there's a way to actually prevent this, and that is simply by breast cancer screening. Breast cancer screening is extremely powerful and critical. I cannot overemphasize this enough. At detecting a breast cancer when it is small and more likely to be cured. And so it is imperative that us as Black women get our screening mammograms. This is Breast Cancer Awareness Month, October 2023. If you are a Black woman, and really a woman of any race group, 40 and over, you should be getting a screening mammogram every year. Now, some countries and some bodies recommend that this be done every other year, and that's okay depending on where you are in the world. However, if you're in the US and you have access to care, whether you're insured, underinsured, or completely uninsured, there are ways to access basic preventative care, of which screening mammogram is one. And so I cannot overemphasize this enough. If you are a Black woman or any woman, particularly a Black woman, it is particularly critical for you to get your screening mammograms once a year, so that if you happen to develop breast cancer, it can be caught at an early stage when most curable. And hopefully spread this message out to your sisters, your cousins, your friends, your mothers, your children. Hopefully, if we all pay attention to screening, perhaps with time we can begin to close the racial gaps in outcomes that we see for women with breast cancer. Thank you. Again, this is Bisi Ademuyiwa talking about racial disparities in breast cancer during Breast Cancer Awareness Month, October 2023. I hope you enjoyed this video. Please share. It may save a life. Thank you.